The most common type of scoliosis in the adult form is adolescent scoliosis affecting the adult patient because of pain and discomfort. And this is true whether they were diagnosed in the adolescent stage or not, because the curve never progressed and they never actually had a diagnosis. However, there are cases of adult onset scoliosis, and this is typically one of two types. Traumatic scoliosis as a result of some kind of trauma that initiates the curve, and that could be internal or external trauma, meaning external like a fall or injury, internal trauma like some kind of disease or problem that causes the scoliosis to occur. And then the secondarily is adult onset as a result of degenerative scoliosis. Now this happens because something remains uncorrected in the spine, typically the lumbar spine, and it causes the spine to deteriorate more rapidly in one area relative to the rest of the spine. This rapid or early onset of degeneration in this area can cause a curvature to occur, and normally it's diagnosed somewhere around the 50 to 60 years of age, and typically pain and stiffness is what brings on the diagnosis. But however, the most common type of scoliosis we see in the adult form is actually adolescent scoliosis that was either diagnosed or not diagnosed, causing pain in the adult form. And a lot of times the first diagnosis could be because you're experiencing pain. They go get an x-ray, they found they had scoliosis, but they truly had scoliosis as an adolescent, because we know scoliosis in adolescence doesn't cause pain in children, and typically only causes it into adult phase when they worsen because they don't treat it properly.